check. Discovery has made it mandatory that its staff get vaccinated. The insurer says its policy is driven by a moral and social obligation to protect people. So we take a look at this policy and what the law says about forcing employees to take the COVID-19 jab. And are we likely to see more companies implement this? Let's speak to public health lawyer Safura Abdool Karim from the Wits School of Public Health. Thank you so much for making time, Safura. A bold step by Discovery. The company says it's not so much about the law, but the moral and social obligation and even the legal obligation to protect employees. But can this be challenged by workers who are against this policy?
So I will say that the legal position of a vaccine mandate for COVID-19 is not set. It is possible that such a mandate at a workplace could be overturned by the courts or it could be upheld. We don't know. But what we can go off of is previous decisions that have enabled the government and other groups of people to limit individual rights in the interests of public health. So we do know that there is precedent for introducing something like a workplace mandate, and we know that this is part of fulfillment of the employer's obligations under the Employment Equity Act and Labour Relations Act.
What happens if employees object on medical or religious grounds?
So each employer will decide themselves what type of policy they want to introduce. But I will say that Discovery has announced something that is very promising and I would say is very likely to be the type of model that employers should adopt should they want to introduce a constitutionally compliant workplace mandate, because they have introduced not a blanket mandate that says every single employee must get vaccinated, but rather something that offers an employee an opportunity to, on the basis of religious or cultural beliefs, apply for an exemption that will then be considered by Discovery, and they will make a case-by-case determination. And I think something like that is absolutely critical. An employer who says, get vaccinated or you'll be fired, is probably not going to pass constitutional muster.
Yeah, so the sooner we get that legal clarity, the better then, right? Because it seems like the Labour Department says at the end of the day, this is a decision that respective companies have to take, but we need that legal certainty on what's more important, as you said, the greater public health or the safety of workers or people's rights to bodily integrity.
Undoubtedly, and I think this is not a question just for employers. This is a question that we as a country are going to have to reckon with. What prevails in this situation? And what we've seen throughout the pandemic is that in most court decisions, the courts have erred on the side of favoring public health, because the COVID-19 pandemic has been exceptional. It has been incredibly severe. It has changed the way we live our lives. It has changed the way our society operates. And I think that type of exceptionalism it's made sense for the first parts of the COVID-19 pandemic, but we need to start thinking about how we live with this epidemic and how do we create functional work environments with this epidemic. So there's no doubt with the high levels of vaccine hesitancy in South Africa that a lot of companies are going to have to think about how do they manage this risk. And at the end of the day, it's actually their risk, it's their liability, so they're entitled to do that.
But they can't just take the decision, right? There must be due diligence that is done. So my understanding is that the company must make a safety assessment first so that you can see if you can't accommodate those that don't want to take the vaccine. You don't just decide that you're implementing mandatory vaccination. What is it that companies need to do first before taking this approach?
So I will say we actually have a little bit of precedent from another epidemic, which is the HIV/AIDS epidemic. Yeah. And what we know is that employers have an obligation to make reasonable accommodations. So where an employee is at risk, and in the case of somebody who's HIV positive, it may be something like they're immunocompromised. In the case of COVID-19, it's going to look slightly different. But taking from that, we know that employers are required to make a reasonable accommodation. Now, what that looks like varies considerably depending on the work environment. So what a mandatory vaccine policy would look like in a hospital or a grocery store is radically different to what it might look like in a job like yours or in an office job, where somebody is able to work at a distance, is able to maintain social distancing and not put others at risk. But where somebody is performing something high risk, reasonable accommodation becomes less and less practical, and therefore choosing not to get the vaccine creates a bigger risk and therefore justifies an employer's decision to terminate much more easily. So it's a sliding scale, if I can put it that way.